Well, hello there. My name is Dr. Thomas Levy. I'm a cardiologist and an attorney, actually, and I've written quite a number of books over the last 15 or 20 years on vitamin C, dental toxicity, and a few other topics, dietary toxicity. And I just want to briefly introduce to whoever's tuned this in to the topics I'll be talking at the ICIM conference in March in Philadelphia. I'm going to be talking about one topic, which is the toxicity of calcium and calcium supplementation. I wrote a book entitled Death by Calcium, and let me just say that's not an exaggeration. Calcium, while being absolutely essential for life in lower doses, when you start dosing larger amounts of supplementation above a certain level, believe it or not, calcium actually becomes a carcinogenic agent. It actually induces cancer. Most cancers are actually characterized by abnormal calcium deposits. It's like it's a cause and its effect. But I will say that inside the cells, there is not a single disease process that is not characterized by increased intracellular oxidative stress, which is induced by and related to increased intracellular calcium levels. And so I'll talk about that and the things that you can do to mitigate it and make it better outside of taking the many arguably not very useful and highly toxic osteoporosis agents they have out there. Then in my second presentation, I'll be talking about the now well-established effects of silent oral infections on the body's oxidative status and disease in general. And more specifically, I'm going to cite evidence that makes it very clear that nearly all heart disease and heart attacks are caused, not associated, correlated, linked, but caused directly by pathogens from the mouth, infected teeth, infected gums, infected tonsils. Okay, this is actually, although it's still being incredibly widely ignored, it's well established and wide open in the literature, hidden in plain sight, as they like to say, that this is no longer just a suspicion, but a hardened fact. The cardiologists out there all know that inflammation causes all coronary disease, but for some reason they don't want to peel another layer off the onion and ask, why the heck are the coronary arteries inflamed? And they're inflamed because they're all colonized by incredibly potent oral pathogens. Well, aside from the known toxicity of root canals and their known infections, it turns out that there is a very large number, somewhere between 5 and 15% of all adult teeth are chronically infected and abscessed. But it's also characteristic for these teeth to be asymptomatic and not hurt and not show up on regular x-ray. What they do show up on is a special x-ray known as a 3D x-ray, a 3D cone beam imaging examination. And so the point of the second lecture is that the paradigm of how a medical and dental patient is worked up needs to be changed. And this test, because of the fact that it will reveal something that you can't find by other ways, that completely will account for your heart attack, your cancer, and aggravating or causing any other chronic degenerative disease, it simply must become a part of the routine evaluation, just like you do a glucose, or you do a cholesterol, or you do a complete blood count. Nobody knows if you have a blood sugar of 350 when you walk into the office. You got to do the test. And nobody knows if you have a tooth that's horribly infected, that doesn't hurt, and does not show up on routine dental exams. Oxidative stress underlies all disease, 100%. And as it turns out, and this is why this is so important, infections and chronic focal infections are far and away the single primary and most prominent reason for having oxidized inactive biomolecules in your body causing all disease depending on where they're concentrated and where they're located. I would say if you come to this conference and absorb the information that I've put together, your practice should and will change, and for the better. And I might add too, not that I'm suggesting this is the primary reason doctors practice, but you'll do more good for your patients and the pie will increase in size and you'll make more money.